Thank you for this great opportunity at HVC Kyoto. I am Wataru Takimoto. I am manager of PuREC, the biotech company with ultimate cell therapy called LEC. To illustrate our business, let me start with the challenges that we are facing. $2 million per year. What is this number? This is an annual cost for a patient with hypophosphatemia, an ultra-rare bone disease to survive. Just for a year, this could continue throughout the entire life of the patient because there is unfortunately no cure at all for hypophosphatemia. There is a hope though. MSC, mesenchymal stem cell, derived from healthy human could cure this disease, hypophosphatemia. There are a few preceding clinical experiments on actual patient bodies. However, there has been a limit with this method, mainly because of the purity of the cells. Actually, regular MSC are not really pure. Under the currently prevailing methods, MSC are just a mix of several different types of MSC. Some of them are not only ineffective, but also could be preventative for the effectiveness of the cell therapy. Our product, LEC, revolutionarily conquered all the challenges associated with regular MSC. First of all, LEC is pure. Using flow cytometry or FSCS with two special markers, we obtain the candidate cells for LEC. There are only 0.04% out of human bone marrow cells, so it is a very selective population. Further, we have developed a method to select the very best from the candidate cells. For example, like shown in this picture, out of 19 cell well, only a few clones can be LEC. LEC is expanded from such a uniquely selected best single cell. In short, extremely pure. Consequently, LEC rapidly expanding cells are showing quite different features from regular MSC. First, it does grow rapidly as it is named. Reaching from one single cell to 10 to the power of 12 level can be achieved within 12 weeks. Secondly, it does show clearer differentiation abilities, especially bone tissues. Lastly, and probably most importantly, LEC can migrate freely throughout the human body without causing any clogging. In other words, LEC is low cost, effective, and safe. LEC is now under 2 clinical trials this year. First, Phase 1 two-way trial was initiated by Shimane University for the disease I just introduced today, hypophosphatemia. It is a system for injection. The method is allogenic, but in order to ensure the engraftment, we are currently matching at least 3 of 6 HLA with the bone marrow donors. There are several endpoints including safety issues, but LEC engraftment is one of the important efficacy points. Also, Hokkaido University is currently conducting another phase 1 two-way study for spinal canal stenosis. This is a local injection of LEC with organic acid gel to keep the cells at the target joint area. The cells are totally allogenic and no HLA matching is necessary because the area does not really have much immune responses. Totally 45 cases are planned under the double-blind test model. There are several endpoints. Pain scale and MRI observation are the key point for the efficacy. Finally, let me touch our target market as well as our business model using LEC. LEC can be applied for various kinds of diseases as other MSCs are used. However, as a small startup, we are currently focusing just on bone-related diseases, like hypophosphatemia, spinal canal stenosis, and other joint diseases. As just mentioned, 2 clinical trials just started at 2 university hospitals. Just with these diseases, the target market could be more than $20 billion. If we can scoop up just 5% of such market, it will be more than $1 billion. To achieve our business goals, the management team of PuREC is a set of quite experienced and balanced senior members. There are PhD, 2 are MD, including our very founder, Dr. Yumi Matsuzaki. The president, Hide Takahashi, is the only person without PhD, but had drug development business experience both in US and Japan. I hope we can have further deeper dive with potential partners and investors to support our future development of unique cell therapy, LEC. That brings me to the end of my presentation. Thank you for your attention.